Kevin Watson is a 6-year-old male kindergarten student at Willowbrook Elementary. He had evaluation dates in October of 2019. His first test administered by the psychological examiner was for intellectual and cognitive abilities. It is the DAS-2, Differential Ability Skills 2, Early Years Upper Level. It assesses the cognitive abilities of children, and it measures verbal reasoning, perceptual reasoning, and visual spatial skills, so things that he can see and understand. His general intellectual ability fell within the low range, which means his cognitive abilities are low compared to his same age peers. His verbal ability was significantly higher than his spatial ability score, so his overall score should be interpreted with some caution because he scored so high in one area. That area is brought down by the lower score, and then the lower score is brought up by the higher score. During the copying part, Kevin became frustrated when he couldn't copy the picture and would scribble on the table. His overall score was 69, which is in the second percentile, and it is in the very low range. Another test that he took was the Kaufman test of educational achievement, third edition, or the KTEA. It measures academic achievement in reading, math, and writing skills. In the letter and word recognition for Kevin, he scored a 59, which falls within the low range. He was able to identify 6 letters, and his teacher reported that he's very inconsistent in recognizing letters. Sometimes he would identify a letter, but then if you asked him later in the day or the next day, he would not identify it correctly. And then Kevin's reading comprehension score was a 69, which falls in the low range. He was able to read a few simple CVC words like bed, bug, and cat, but was unable to point to the picture that went with those words. For his math concepts and applications, his score was a 71, which falls in the below average range. He was able to count one-on-one and answer addition problems with a visual, but he was not able to count out a correct number of objects from a larger amount or complete a repeating pattern or identify a group as more or less. For social, emotional, and behavioral testing, he was administered the ADOS, or the Autism Diagnostic Observation Scale, second edition. It assesses communication, social interactions, play or imaginative use of materials, and repetitive behaviors. He was administered the Module 3, which is used for children with fluent speech. And it has 3 possible categories: autism, autism spectrum, and non-spectrum. And Kevin's scores fell in the autism classification with a high level of autism spectrum related symptoms. So in his language and communication on that test, he showed that his language was mostly complex, but there were grammatical errors. He did not display echolalia, and his conversational skills followed his own train of thought and were not reciprocal. And he displayed very limited gestures. For his social interaction during that test, he displayed adequate eye contact, but had limited facial expression, which were not directed at the examiner. He also kind of ignored the examiner when she tried to play with him. For restrictive and repetitive behaviors, he didn't engage in aggressive behavior, and he was able to sit in his chair, but he would fidget, and his activity level was low and appeared tired at times. He also was administered the BASC-3, or the Behavior Assessment System for Children, 3rd edition, and it assesses a variety of emotional and behavioral problems. For Kevin, the parent did not fill out the form, but his special ed teacher did complete the form, and his teacher indicated that he was at risk for developing significant problems in hyperactivity, externalizing problems, attention problems, school problems, behavioral symptoms, and executive functioning and negative emotionality. His teacher also indicated that he was at clinical significance for problems in conduct and anger control. He was also administered the ABAS-3, and it assesses adaptive behavior skills needed to successfully care for oneself and respond to others and meet the environmental needs at home, school, and in the community. His overall score from his parent was an 85, which is in the below average range and the 16th percentile. His teacher's overall score was a 70, which is in the 2% rank and in the low range. His conceptual skills area fell in the average range for parents, but it fell in below average range for his teacher. And then his parent ratings fell in the below average range and in the low range for teacher for leisure skills. And his social interactions, his parents' ratings fell in the below average, and for teacher it fell in the average range. For his practical skills, such as getting around the community, his parent ratings fell in the average range, but in the extremely low range for his teacher ratings. And for self-care, his parents rated him in the average range, and his teacher rated him in the below average. For speech, he was given the GFTA, which is the Goldman-Fristow test of articulation, and that measures the ability to articulate consonants and single words in the initial, medial, and final position. His standard score was a 76, which is in the low to moderate range. So he had errors in all areas, some in more than others. Also for speech, he was given the Arizona Articulation Proficiency Scale, or AAPS-3, and it assesses the ability to produce phonemes at the word level. His score was a 78, which is in the 7th percentile and in the moderate range. It indicates his articulation is moderately delayed when compared to his same age peers. He was also given the Brief 2 for behavior rating inventory of executive functioning, which measures executive function behaviors at home and at school. So his parent score and his teacher scores were very similar, and they indicate a mild elevation in some areas, and then other areas he was clinically significant. Overall, I agreed with most of his tests. The only one that I feel like might be inconsistent was the KTEA-3, where he was observed reading some CVC words. I have not seen him read words in the classroom yet because he has yet to identify all of his letters and letter sounds. But overall, all of these tests seem to fit with Kevin and his personality and what we see in the classroom, and fits with his abilities and what he qualifies for in special education, which is reading, math, writing, and adaptive behavior. Thank you.